Hi, everyone, and welcome to the Best on Wellbeing podcast. Thank you for joining this newest interview podcast episode with my good friend Ibrahim Ismayilov. As I mentioned in my Facebook post, he's an interesting guy, a bit of a renaissance man. He's a businessman, he's a nurse practitioner, he's a psychotherapist, he's worked with refugees, he's done a lot of interesting work in his life, and he interviewed me on a number of topics that we're going to cover here in the next hour: adult ADHD, mental health medications, cognitive neuroscience. So we review a number of different topics. I hope you enjoy it. I hope you find it informative. And without further ado, I bring you Ibrahim Ismailov.
Hey everyone, welcome back. Today I'm joined by Guillaume Tremblay, who is also a nurse practitioner working in mental health. We are going to talk about ADHD, mental health assessments, treatment, and some of the misconceptions people have about these conditions. Thank you for being here. And maybe to start, can you tell us a little bit about yourself and how you got into mental health?
Well, it's great to be on your podcast, Ibrahim. Thank you for having me. Been a nurse practitioner for about, I guess, almost 12 years coming up now. I was a registered nurse before. I've always enjoyed mental health, I guess, my whole life since even my teenage years, very curious about, spirituality and what it means to live the good life and be well. And that kind of carried on to my nursing career. At the bedside, I did many years a bedside nurse. And I knew that once I was going to become an NP, that for me to assist with mental health would be an important part of my career that I would just very much enjoy and be passionate about. And luckily, I my first job as a nurse practitioner was in a northern community, a small northern community. Shout out to Chapleau, Ontario. Great folks up there. And and then basically the physicians up there were pretty much happy to have a primary care provider that had an interest in mental health. So I was kind of exposed right away. If there was issues with mental health, they would kind of start sending people my way. And there was a wonderful psychiatrist, Dr. Richard, shout out to Dr. Richard, who would come up as a locum once every month or two. And I learned a lot from him as well. So I just got exposed really early on in my nurse practitioner career, and I've never looked back. And now I work in a psychiatric center. I have a mental health practice on the side, so I do quite a bit of mental health as part of my ongoing career.
And that's very interesting because a lot of nurses in their career as a nurse, if they were not exposed to mental health, it might be even more difficult to work as a nurse practitioner. And you started that from the get-go.
Yeah, I mean there is a that needs to come, especially with the medications. I mean, there's been some challenges, there's been some mistakes. Every provider does mistakes along the way. I I don't want to taint my reputation here, but there was a mistake I'll share that, I was early in my career as a nurse practitioner. You're learning the ropes, maybe a bit more naive. And I had a young man who was actually a pretty clear history of bipolar disorder, and somehow kind of convinced me that his bipolar diagnosis wasn't very true, and he just had an anxiety issue, and convinced me to put him on a medication, an SSRI, as you know well how those work in your NP background as well. Uh, and I ended up sort of a manic episode in this gentleman, and so mistakes can be happening. I was pretty new and early on, so developing a certain feel for these medications and knowing how to prescribe them appropriately, know when to not prescribe. I mean, that took some time. Again, learning from experts like Dr. Richard, um, making mistakes, seeing what works well, and observing when things do work out really well, and trying to remember review your notes and how things panned out and what steps you took. So all those things kind of accumulate. But yeah, I mean, I wouldn't say I have the comfort level back then that I do now. I mean, that takes time. 12 years in, and definitely more comfortable now. But even sometimes today, like there'll be complex cases where you're like, was that the right call? Am I doing this correctly? So, but yeah, I was exposed early on, and just was happy to be exposed. I was really kind of itching to jump in there and give it a go.
That was a really great example. And I think it can even relate to some of the ADHD medications,
Hmm.
because if someone has a bipolar disorder, but if they think they have ADHD and they convince you they have ADHD, the same response can happen with a brain stimulant. It can kind of activate you and you can go into a manic episode.
That's
But
right.
that also brings me to my first question, um, because we're talking about ADHD today.
Mhm.
What do you think people misunderstand most about ADHD from your clinical experience and maybe even from your personal experience?
I would say my expertise now is more in adult ADHD. Um, I mean, I have been exposed to a certain degree to, children with ADHD and managing that. But for the most part, my career has been with adult ADHD. I think, some misconceptions is like it's that, especially with adult ADHD, that it seems to be this new trend that I'm hearing it's a trend now that a lot of people are self-diagnosing with ADHD, that it's perhaps just um, just an inability to really try to pay attention and focus, that it's not really that much of a thing amongst the adult population. And since I've been more involved with treating people with adult ADHD, it's quite remarkable. Folks that really get a lot better and feel a lot better once you treat them appropriately. Now, it is true that sometimes people will think they have adult ADHD and they don't, and prescribing some form of stimulant will not help them, and probably need to take a different avenue altogether. So that can happen, and I'm not saying that never happens, but it seems to be there still seems to be a sense of hesitancy to take the possibility of undiagnosed adult ADHD seriously in our current times. Like it's an interesting thing to me, a phenomenon, because when we talk about depression or generalized anxiety disorder, it seems that we don't want to have any stigma around it anymore. That it's if you show it to your doctor and you're like, I'm depressed or I'm anxious, and they're like, sure, here's an SSRI, no problem. And if you sort of push back, well, is that necessary? Maybe people are just feeling down and they need to get their shit together. And if you say things like that, then it's not cool. You're stigmatizing mental health. And I think for the most part, I tend to agree that it's a good thing that we're open, and SSRIs, when needed, when appropriate, are prescribed without stigmatizing the person. So those are very good steps forward. But it seems like we're not quite there yet, in my view, or at least expertise, because sometimes people do come to me for to treat adult ADHD when they've been to multiple providers that just won't really think it's a big deal. And you know, you just got to face life. It's just you're just disorganized all the time. You just got to figure out how to get organized. You hear things like that, and and then you treat them, and then 4 weeks later, like, holy moly, I never knew I could like exist like this. I feel so much better. At the same time, I would say there are people that it's it's hard to diagnose sometimes. People are on the fence. Their symptoms, their presentation isn't very clear, and I have had situations too where you maybe lean in the direction of, okay, let's treat this as adult ADHD, and it doesn't work, and it's not obviously probably not the correct diagnosis, but at the end of the day, it's not a big deal. You just stop the treatment and try other avenues. So I do think there's actually quite a bit of stigma in my view right now about the idea that there are undiagnosed folks with adult ADHD. And at the same time, I don't mean to go too long on this, but I think it's tricky too for adults that maybe truly do have undiagnosed ADHD to be careful in terms of how to have a relationship with the diagnosis, because as though some people, they felt it for decades. They just always knew something was up. And then when you finally acknowledge them and say, yeah, I think this is adult ADHD, let's treat it, let's see what happens. And there can be the trap of like, oh, okay, well, finally I know what's my problem. And, as though having a diagnosis extremely cathartic and capitulates into this, transition towards much greater well-being. And I think there's a bit of over expectations around that. And at the end of the day, the best analogy that I've heard people describe about being on medications with adult ADHD when they haven't been treated, it's kind of like someone who has like needs glasses and had never thought they needed glasses, but they've needed glasses for like 20 years, and they finally get the right lens and they put on the glasses. It's like, oh, everything's just more crisp all of a sudden. So it's not drastic, but all of a sudden the brain is like, it's like putting glasses on the brain. It's like, oh, everything's more crisp all of a sudden. But the hard work of life, of being disciplined, of getting things done, of staying on track, of communicating with our social interactions, and all the hard things that make, or the challenging things that make life, that support our well-being in life, those things are still there. So it's less, I think the trap of like, finally, I'm going to be okay now that I'm treated and I'm diagnosed. It's like, well, no, we're gonna treat it. It needs to be treated, but the same journey is ahead of you anyways. So
I like the comparison that you made, and it's a great metaphor. It's like you put on glasses, and all of a sudden everything looks different. And
yeah.
that's if you get the right treatment, that's what some patients they can have that experience. And you know, some of the things that is very interesting to me, and it fascinated me, is even before I became an MP, how do you distinguish between ADHD and anxiety, right? Because sometimes they can happen together, but and
Mm-hmm.
if somebody is if they think this person has anxiety or depression, and then you start treating them with SSRIs. But what about ADHD? What type of medications can also help with anxiety for ADHD, right? Like
Mm-hmm.
SSRIs is not always going to be the best answer, right?
Mm-hmm. Agreed. Agreed. And I mean, there are situations where perhaps you can combine them. I've done that before too, where SSRIs and um, methylphenidate, Ritalin, or long-acting Ritalin, Concerta, is utilized with an SSRI. I mean, there are situations where that can be appropriate. It is challenging, actually. Sometimes I think there's a bit of myths around the process of diagnosis. Now, I know generally with ADHD, you're supposed to get like sort of corroborating evidence from different environments. So let's say somebody who might get a coworker for adult ADHD to describe a little bit of what it is to interact with them, and then get the same kind of gather the same data from, let's say, this person's spouse, and then try to see if they collaborate. So it's like kind of what we do with children, where you get data from the parents and the teachers, and they have to kind of match in order to strongly support a diagnosis of ADHD. But mental health in terms of diagnoses, I mean, even the concept of diagnosis is challenging, especially with mental health. Like nobody's going to be, sorry to just take a little tangent here, but um, if I catch pneumonia, I'm not going to be like, "Hey, Ibrahim, I'm a guy with pneumonia. Like I'm a pneumonia guy." Like it's just,
Let, let's
I'm not.
let's treat with antibiotics.
Yeah, you'll just be like, "Okay, whatever. Here's antibiotics. Like it's no big deal." But with mental health, it very easily can become, because the interface between our personality and our mental health, it it's much more connected and kind of closer interaction. And so the risk of developing an identity, or sort of building an identity, a sense of self around a diagnosis, as though it's a meaningful expression of who we are, it's very challenging to navigate patients to try to not do that. And diagnosis, the word diagnosis originally comes from Latin, which basically means knowledge over time. And so knowledge over time, that's it. It basically, knowledge can like over time will change, and diagnoses are not as fixed, or they're more dynamic than people might realize. So when I talk to patients and say, I'm going to need a we're going to have a diagnosis here, it's more about what is the correct knowledge in this point in time in order to assist you to be well. That's the question. It's not exactly, haha, let me stamp this diagnosis on your forehead and now you are this person with this disorder, and there we go. But obviously, distinguishing between a pattern of ADHD and a pattern of an anxiety disorder is very helpful, because the correct knowledge will lead to the correct treatment. And so I would say that is a challenge. It's not an exact science in terms of how we do that, but yeah, getting a little bit of a feel for it. So, for example, actually just this week, I got referred somebody that was told that they're like, I think, they're not, this person is, they were a psychotherapist and they do a good job. And he's like, I think they have undiagnosed ADHD. And they've been correct many, many times, and they don't claim to diagnose, but they just give an impression, which is appropriate. And this person came to me, and it's a very subtle thing. So but a good proper history taking and getting a feel for it. But so definitely challenges, a lot of challenges with anxiety and some degree of focus. But sometimes we can't focus because we're anxious. So is the inability to focus because you have ADHD or because you're just sort of overwhelmed with anxiety and low mood and lack of sleep? But one thing so I was on the fence. I'm like, I don't know which direction to take. And so, but one thing kind of came clear is like, so when we look into the background, okay, so no teachers had ever suspected ADHD as a child. So that's a clue. Number two is she was a young woman. She never liked high school. Okay, never interested in high school. And but she got B's. She pretty much was a B average student, which again doesn't quite fit the profile historically because ADHD sometimes they can hyper focus on things they're interested in. That's something that can happen and be completely disinterested in things that don't attract sort of their what they like and things like that. So if somebody didn't like high school and pulled off a bunch of B's, it's like, I don't know if that's ADHD. But anyways, so it's a bit subtle sometimes. But anyway, we took a different route. We didn't go with the diagnosis of ADHD, and we'll see what kind of outcomes we get from that. But vice versa, sometimes the inability to focus because of ADHD produces a tremendous amount of anxiety. Like, for example, I've seen young men, like a 33-year-old man, responsible, wants to be good husband, father, wants to do a good job, very willing person to work for their family and stuff. So it's the weekend and they just can't complete anything. Like they start a job and the grass is half cut and this project's half started. They try to be nice and get a load of laundry started for their spouse, but don't even like carry on that task. And so they end up Sunday night with 7 different tasks that got started and nothing's finished. And they're just overwhelmed with anxiety and their spouse is unhappy with them because not that they didn't do anything that wrong, but it's just like, what are you doing? Like, and it just can't seem to get rolling. And
That's
therefore,
ADHD in a nutshell. Executive dysfunction, isn't it?
yeah. Yeah, and so that inability can produce a lot of anxiety. So it can masquerade as an anxiety disorder, and so if you do anxiety testing, you find that their anxiety is quite elevated, but it's not because of an anxiety disorder. It's just sort of a knockoff. It's sort of an effect of this poor executive functioning, as you just said. And so I find that um, when you can correct it, and one guy that I did diagnose adult ADHD, young fella in his mid 20s. But then, so first of all, his executive functioning improved. So he could get the things he needed to do in his life done. So he felt a lot better. But then something that he always wanted to do, meditate, he started to meditate because he could focus. He could just focus on his breathing. And so it was almost like a stacking effect that happened where he really thrived afterward, not because the medication was that miraculous. And he wasn't even on a big dose, but it just got him over the hump where all of a sudden it's like these things that were producing anxiety fell away. And then he could actually really work on his well-being through kind of other means, such as meditation, which was never accessible to him before. And he became accessible and he did a lot of the hard work. So a lot of the credit towards improving his anxiety is to him. So that's kind of an interesting thing that can happen that you end up improving the anxiety just by improving the executive functioning.
This is really interesting. And it brings me to my next question, is because you have done a lot of work around mental hygiene, but also
Hmm.
about default mode network. And I
Yes.
always I always think when I hear those terms, I always think of you. But like I mean, if we're just talking about default mode network in a
Hmm.
very simple language, what's default mode network?
That's a good question, Ibrahim. Uh, well, the
I
e-
mean,
the
why should an average person even care about default mode network? To me, it
oh
just sounds like a medical term.
yeah, no, I mean I love talking about the default mode network. I'll just put a little caveat that there's some differing opinions on the role of the default mode network because it's still a network in the brain that's being mapped out. Brain science is extremely uh, complete. It's inferred, like we basically see. the movement, like one technique in, so I'll just a little preamble. I know we're not supposed to get technical, but like how we look at the brain for the default mode network is what's called functional magnetic resonance imaging, like an MRI, but it looks at how the brain's acting live. And there's a technique where basically they just see the movement of oxygen into the neurons. And so when there's movement of oxygen into the neurons, we infer that there's more activity of that part of the brain. And so that's how you can see, okay, this part of the brain is more active. Why do we say that? Because the movement of oxygen in terms into the neurons is what the inference for activity. So it's just to point out that like this is a very I still think we're very infancy in terms of brain science, but that's a part of the fun. But the default mode network, I guess traditionally, is associated with very common cognitive patterns that we call that we all can recognize. So exactly talking to ourselves, the sort of the self chatter that we just hear our own voice in our own head, autobiographical like autobiographical narration, talking to ourselves about our life and our past and our future. That typically, when you ask somebody, what are you doing right now? Well, I'm talking to myself. And then while you're scanning their brain, they see the default mode network, which is really midlines of the brain. It's a structure of the brain. There's two main hubs, the medial prefrontal cortex and the posterior cingulate cortex, these two hubs that seem to send signals back and forth in the midbrain. And it's associated with things like rumination, when you mind wander excessively, when someone's talking to you and you're not really listening, you're somewhere else. So talking to yourself, or another fancy word is self-referential internal narration. So talking to yourself about yourself all day long. And the reason we call it the default mode is because the brain defaults back to activity there. So right now, I'm kind of doing an activity with you. I am in a task. I am doing a podcast with Ibrahim. So I am tasking. So there's not that much chatter in my head right now because I'm focused on doing a task, which is this podcast. But once the podcast ends and we close up and I go upstairs and I sit down, my brain, because the tasking is done, will default to the default mode network. So all of a sudden I'm like, we can say that the blah, 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 the narration, the talking to myself will reemerge, so we call it the default because the brain defaults back to that network in, let's say, a resting, non-tasking state. So historically, there's some debates on the degree to which the default mode network is associated with risk of mental health issues. I'm of the view, based on the literature, that when the default mode network is too active, when there's too much blah, 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 too much internal narration, too much talking to yourself all day long, this hamster wheel, the monkey mind, whatever we want to call it, when it's go, 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 and there's no quietness in the brain, then we are more vulnerable to mental health challenges. So anyways, that's a bit of a nutshell. But yeah, I love talking about the default mode network, and I do think it's important. I think it should be common knowledge. It should be common knowledge. And there's a lot of evidence that when that part of the brain is hyperactive, that people are more prone to depression and anxiety disorders, and even to a certain degree ADHD, although that's less clear. But so yeah, we should, I think, know that when people say, "Oh, a quiet mind," like a quiet mind seems like this spiritual term, a quiet mind. Like as if you go to a spiritual seminar and that's where you're gonna hear, like as if it's some sort of, you know, out there pie in the sky idea that who cares about a quiet mind? Like, no, we should care. We have 20 years of solid brain imaging research that has highly mapped out the default mode network of the brain. And when that part of the brain is too active, people tend to feel less well. And I think that's important information, and it's not hard to understand. I think everybody should know about that.
I mean, how can you make default mode network not as active? Is there anything you can do in order to reduce, my chances of defaulting back to that, right? Because
Yeah.
that will reduce the chances of me going into ruminations, right?
Hmm. Exactly. Well, so that's where it gets a little controversial because I actually did one time a radio show with this guy called Dr. Nathan Sprang, and he's a cognitive neuroscientist in Montreal, McGill University, and he does a few talks, and his talks are like, you people should mind wander. Let them mind wander. Let them, you know, let them their thoughts just go. And in fact, he says we don't do that enough. Like nobody just sits there beside a tree outside at a park and just lets their mind wander. We're either on our phones or we're doing different stuff to distract ourselves, but nobody just lets their mind wander. And there's been some interesting papers in trying to distinguish between sort of a gentle mind wandering and rumination, which both seem to come from the default mode network. But again, even the default mode network has subnetworks. So it gets kind of tricky to know how to properly distinguish that. Um, but yes, there can be. So the real pathology in terms of when it's a problem with the default mode network. Okay, I'll give you an analogy that I always do at my mental hygiene talks. Okay, I've used it hundreds of times, and it's kind of silly, but I think it makes sense. It's comparing it to you know, dental plaque. Okay, if you just follow me for a second, dental plaque is totally normal. Excuse me, completely normal. It's everybody has it, and it's impossible to have no dental plaque. Okay. So when we brush our teeth every day, we don't do it to eliminate dental plaque. We do it to minimize excessive dental plaque because it's when dental plaque becomes excessive that we have issues with dental health. And it's similar idea. So that's just a metaphor, an analogy for the default mode network. The default mode network is not something to demonize in the boogie part of the brain, like ooh, we shouldn't have any default mode network activity. That's not true. So obviously it has a very purposeful evolutionary design to you know how it sort of integrates different networks. There's different reasons to believe that the default mode network is extremely important. But it seems to be, and there's a lot of evidence for this, that when the default mode network activity is excessive, when there's just too much activity, and in fact, how do you define excessive? So that's the other thing is the problem when the default mode network becomes a problem is when the switch between attention networks or tasking or executive networks and the default mode network, they can't switch back and forth properly. When the default mode network becomes too dominant and you can't just return between different networks. So I'm paying attention. Okay, then I sit down and there's a little bit of mind wandering, but I can return to attention. I can reactivate my attention centers. I can switch back and forth. That, not to overly define, but that could be, let's say, a healthy brain. So when the default mode network is dominant over attention networks, that's when we could say there's becoming or we're vulnerable to problems. It's the excessive default mode network that leads to being more vulnerable to mental health challenges. So there are not lots of ways we can try to address excessive default mode network activity. So one classical pharmaceutical, okay, SSRIs have been shown to reduce default mode network activity. And it makes sense, you know, people that like overwhelmed with anxiety and they just can't function. They can't even make decisions. They can't finish any tasks. They can't do anything because they're just overwhelmed with anxiety. And you're like, how's your mind? It's my mind's racing constantly. I can't stop thinking about 100 different things. And you know that at this point, psychotherapy is probably insufficient. So maybe a bit of pharmaceutical assistance would be warranted. So start an SSRI, it takes effect, they respond well, no adverse effects. It's a good response to the treatment. And that's what you hear from them. It's like, man, my mind is just so much less busy. So it has a direct impact. So that's one, like a pharmaceutical approach. And then there's all the different stuff that you, like you said, mental hygiene. That's sort of a bit of my work is trying to share that there are multiple ways we can slow down the default mode network. One interesting, easy one is like no nature exposure. You know, just walking in nature and try and really pay attention to the trees and the birds, and just walking in nature has been shown in imaging studies to reduce default mode network activity. All the classical things, meditation, deep breathing techniques, journaling, other writing exercises, gratitude exercises. There's so many different ways, but it's ultimately, I think the common factor is to exercise our attention centers. That if we can exercise our attention centers, you can rebalance. So if your default mode network is just too dominant, it's probably because in a certain way your attention centers aren't strong or quote unquote strong enough. So if you can work your attention centers and create that balance again where you can switch back and forth at will, then you restore sort of balance to the brain health, if you will.
So one of the questions that, it's always in my mind is what kind of things can I do in order to reduce my time in default mode network? Like, is it the goal-oriented activities such as exercising, maybe gardening, maybe meditation? Like, how does it work?
Hmm. That's, I mean, that's a very fundamental question. I think that's fantastic. So to a certain degree, having meaningful tasks that require attention is very good. So yeah, gardening and having to take care of the plants and do a good job, um, you know, focusing on an exercise that's, makes you, feeling the discomfort of pushing your body, that pulls your attention. Um, Meaningful work, when you enjoy your job and you try to challenge yourself, it's going to require attention. So all those things are important to a certain degree, that we have different things that we have to do throughout the day that require attention. So we're not, and that's partly the whole saying of like, an idle mind is the devil's playground. I don't know if you ever heard that expression, that, basically if someone who's pretty healthy on all fronts has nothing to do all day long, sooner or later they're going to feel unhappy because the default mode network is way too active, and they're just going to kind of, there'll be too much blah 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 happening all day, and sooner or later that overwhelms their system. So that's part of the basics when we work with mental health is, how can people structure their days and maybe get back to work and engage in meaningful activities, because meaningful activity requires attention, and attention is good in general. But what you're asking is a more deeper question of like, because obviously someone, Ibrahim, you wear many hats, nurse practitioner, psychotherapist, businessman, father, husband, like you got a lot going on. So I don't think you lack any tasks in your life. So that's not the issue. But what you're asking is, what do we do when we're not in a mode of a task, of an actual task? How do we address the default mode network? And that's the important question, because like, so there are many ways that the default mode network can be literally shut off. Like if you take somebody who has skills in skiing, someone like a good skier, and you put them on top of a very steep mountain, and they go down and they ski that very dangerous mountain, like there is nothing happening in their brain, like no default mode network activity, because the attention required to survive that ski route is so intense that everything's quiet and it's just pure attention. So I mean, that's one way to stop the default mode network, but that's not practical. That's not practical for everyday people that have to do buzz around and do a bunch of different things. So what and this is not, I would say I'm part of that movement. I mean, I have that mental hygiene is a certain model, it's a certain framework, but there are many ways to talk about it. But the challenge, or the task we have to apply ourselves, is when we don't have anything to do, how can we maintain a certain amount of attention in this moment? So historically, like this, a lot of the spiritual teachings talk about this, but even modern, you know, positive psychology. So one example I'll give you is one of our mental hygiene practices that we encourage is, if you go for a walk, instead of like thinking about 100 different things while you're walking, why not just coordinate your breathing and your steps? So you breathe in for 3 steps, and then you exhale for 4 steps, and you breathe in for 3 steps, and you exhale for 4 steps. Because when you do that, essentially is you're activating an attention center, even when there's nothing to think about, nothing to do. You're just having a stroll. You're you're still giving attention to your body by paying attention to your breathing and your steps. Couple breaths on the couple steps on the inhale, a couple steps on the exhale. So coordinating breathing and walking is a way to reduce default mode network activity, because even when your brain wants to go there, because there's nothing important to do, no big tasks requiring your attention, you're still giving attention to your body. So it comes down to the question of how to gently, without becoming this like, "Ugh, I can't have any default network activities." Like, of course, some of it's fine. It's not, it's okay to mind wander sometimes. It's all that stuff is fine. But how to continue to activate attention centers, that your attention centers become more the default network of your brain. Like you can still default back to just being attentive in this moment and feeling your breathing and or trying to come up with something in your mind that you're grateful for. Like that, I mean, gratitude exercises, there's tons and tons of evidence how incredibly powerful for well-being gratitude exercises, but they require certain attention. You got to focus. You got to think of like, okay, what am I appreciative of in my life? Like, what is good in my life? So it comes down to finding simple, realistic ways. One, my favorite is something that I call breathing stillness, where nobody's going to notice. Nobody's going to ever, observe you doing it. So it's not like I meditate now and everybody watch me meditate, but it's more this like two breaths. So extremely focused on the feeling of your nostrils, feeling your belly move for two breaths. Stop thinking, you know, and trying to do that as many times as you can remember throughout the day. Feel your nostrils, feel your belly, activate your attention centers, even when you're not doing anything. And whatever's in your mind that you're ruminating, you're thinking about, you're worried about, it'll be there. You don't have to worry. It's not going to go anywhere. But just interrupt the thinking, interrupt the default mode network, switch out of that network, and just so it's the kind of again because even for I'd say most healthy folks, most kind of quote unquote normal folks, there's still a little bit of an imbalance. Too much default mode network activity, too busy. So even when there's, you finish your work, you finish your email, you finished everything you do, then it's like, and then you just sit there, or throughout the day, if you're walking somewhere, like if you're walking from your car to your office, why do you need to think about 100 different things? Just pay attention to your steps, pay attention to your belly. And the interesting thing is that it's a bit of a myth in our mind that the default mode network, this thinking about stuff as though it's helpful, as though it's protective, as though thinking about 100 different things while you're walking to the office from the parking lot will protect you, will make sure you get things done, will make you not forget all those things you have to do. It's not true. The default mode network is not the part of the brain that makes decisions. It's not the part of the brain that helps you regulate emotions. It's not the part of the brain that helps you process information, executive functioning, tasking. So all the parts of the brain that we want to work well, to function well in life, to be a well-adjusted person, are not the default mode network. And in fact, there's one paper that came out that default mode network competes for brain activity. It competes against the parts of the brain that we want. We want to make good decisions. And you see that with
It's
people with
taking
too
up
much.
your important resources from
Yes,
goal-oriented activity towards something that is not bringing you any return on your energy, right? So it's
exactly.
like your mind is wandering, but it's maybe helping you to think that it's helping your anxiety, but it's not.
Right. It's literally not this because like what do you need to feel better when you're worried about something? You need a solution. You need to make a decision. You need to execute on something to address the thing you're worried about. And the default mode network is none of those things. It's not like I don't mean to make the default mode network like this bad thing. And there's reasons to believe to try to understand. We can. I mean, that's a bigger conversation of like why is it a big deal today? The default mode network versus like our ancestors. And there's actually some pretty good theories on that. But it's literally not designed to find solutions. It's doesn't know how. It's not a problem. It's not to demonize the default mode network, but it's just not the part of the brain that will make a decision. Like, and I've seen it before. Like people that in extreme cases, like very high dysfunctional, very high anxiety levels, you can take them to the grocery store and they can't decide between buying the Cheerios and the Raisin Bran. That's how much there is interference with the occipital area is more the decision parts of the brain that make decisions. It's like frozen because the default mode network is so overactive that it's consumed all the resources of the brain. And a simple way to think about that is, especially when we're thinking about a problem, something that's bothering us in our life, there's a big difference between thinking about and thinking through. That's another principle that we explain in mental hygiene. Thinking about is not the same thing as thinking through. Thinking about is more the default mode network, and you think about the problem, and you think, like you just said, as though it's going to give returns to think about it. It won't give returns. It's not designed for that. You're just going to create anxiety and stress, and then you won't be better off to address the life challenge that you have to face. Whereas thinking through, which we would describe as, let's say, taking a piece of paper and a pen and you sit down and you write down the problem and you start to brainstorm. You really think through it. You write down action items, you timelines, like every different, you look at all sorts of ways you can address this challenge. You think through it. Well, then what's happening is the reason that's effective is you are switching to a different network. You're moving to executive parts of the brain, tasking networks of the brain, decision parts of the brain. And so, and naturally, if anybody's tried this before, where you take a piece of paper and a pen and you think through what's bothering you, there's less noise in the head because you've naturally shut off the default mode network and you've moved to a different part of the brain that is literally designed to help you find solutions, to come up with solutions and make decisions. So what's sometimes misunderstood is that being quiet isn't just this like fancy, fashionable, spiritual, I've got a quiet mind, I'm a cool person. It's practical. A quieter brain is a practical brain. It can more easily turn on decision making, information processing, emotional regulation, executive functioning. Like, so it's not just about, I mean, well-being is obviously the goal here, but being well adjusted and functioning in society is certainly not hurt by learning to sort of dial down the default mode network activity.
And I think I appreciate you talking about these issues because, you know, you mentioned that you said our ancestors, and this is totally different conversation, but our ancestors had different worries.
Yes.
They were out and they were physical every day, right? Like if I
Yes.
think of my ancestors, I come from August tribes, and they used to be active all day. So, I mean, they also lived in the present moment. And I think in our modern society, we don't have time to live in the present moment. And this is why our brains, they're thinking like 100 steps ahead.
Hmm.
And when I'm thinking about what am I gonna do tomorrow, I just wake up and all these thoughts are like rushing through my mind. I
Hmm.
have to get this done. I have to write a note for that client I forgot yesterday. I have to do grocery shopping. Oh, I need to go and change my tires, right? These thoughts are like attacking my brain. So
Hmm.
that takes from my ability to live in this moment,
Yes.
right? In the present moment. And this is something that I think you learn from Stoics as well, right? Living in the present moment.
Yes.
And if
Yes.
you learn to live in the present moment, I think it's like those things, right? Like you're enjoying simple things in life, and that's how you slow it down.
Well, very much, very much. I mean, that's exactly right. Like it's just this constant, because that's what the default network does, is it takes you to the future of the past. Because I think being in the moment requires to be attentive to this moment, to pay attention to it, to just be here now. And but to go back to where you're talking about your ancestors, I mean, like it's remarkable because we think of our civilization today and like things change so fast and we forget what 1980s were. It's totally different, and so we quickly forget what it was 200 years ago. So you think about like 200 years ago, 90% of the world population was food insecure. Like, so literally every meal, you're not quite certain if it's going to be around, if you're going to get it. 90% of the world population was food insecure. And today it's 10%. So what a remarkable achievement that nobody ever, puts out there to celebrate humanity. We're always like humans are terrible, but it's like, oh, there's good things too. But just to the point you were saying is like they were trying to survive. Our ancestors were trying to survive. Part of the benefit of that is that they did have less default mode network activity because they were constantly tasking from one to the next. Everything was like, okay, you got to go plow this field, you got to, do this task, go cut this wood, go get the fire going. Like I mean, just the women to feed everybody. Like you get up at 5:30 in the morning, you got to like literally make a fire to feed and somehow cook everything with a smoky fire every day. So there was just so many tasks, one after another, just to stay alive. But that was the way of life. Nobody complained. It was just how life was. Like we compared today, like if you throw me there 200 years ago and throw me there, I'll be like, oh my gosh, this is terrible. I want to go back to my comfy couch. But so they didn't have the luxury that we do to contemplate, to just be there, just sit around. They were just one thing to the next. So there was just not much default network activity because it just wasn't available because the demands of survival were so prominent. Whereas today, as much as we're busy with stuff we make ourselves busy with. Like in my head, that's one of my problems. I constantly complain that I'm how busy I am in my own head. Like that's my default mode network. Like you're so busy. I'm so busy. Oh my God. My first world problems. I'm so busy. And um and so but like what am I busy with? I'm busy with bringing my kid to basketball and like my kid to skating. Like these are we impose these things on ourselves. I could just get my work done, come home, not even go home if I want to. Like I could just go to a restaurant, food, easy, sit there. Like we have so much time available to us today that has nothing to do with survival. That and our brains for thousands of years before that were consumed by tasking to survive. And then within a blink of geological time, very quickly, humans are flooded with this like enormous amount of time that doesn't need to be dedicated to survival. And I think we're trying to evolve into that space and adapt to it. And I think mental health problems and too much thinking and too much default network activity is a natural side effect of that. It doesn't mean it's bad. I mean, I think it's amazing the way the technology, the civilization we've built. I'm completely blown away, and I'm very pro-human kind of cheering on humanity kind of person. But it is a side effect. Like another example I'll give you is like dental. Again, I do a lot of dental analogies, but like in the mid 19th century, so let's say 1850s ish, okay? So dental health wasn't that great like 400 or 500 years ago, but in the mid 19th century, it got a lot worse, okay? A lot worse. And there's actually, you know, evidence like actual teeth and like skulls that they found and stuff like that. And so what happened was that in for the first time in human history, especially in the Western world, regular people, so not just the rich, but regular like farmers and people like had access to refined sugar and refined flour. Because so the average person could finally buy a bag of flour and buy a bag of sugar. That was a new thing. And so that's great. So why is it great? Because there was less starvation, because flour and sugar is a lot of calories. And so food insecurity went down. There was less food insecurity because you had a big bag of flour in the next room in the cold cellar. So good step for humanity. Technology, modern farming techniques, all this stuff improved, less starvation, more calories for humans. It was a good thing. It was a step forward. But a side effect of that was terrible dental health. And it took about 100 years till people clued in collectively that we should brush our teeth every day. And it took a long time, but it was a natural side effect of progress. And I think our current sort of mental health issues that we have collectively is a natural sort of side effect of our progress.
And I think 5 years ago, when I spoke to you about mental hygiene, you were the person who told me about mental hygiene. You were the first one. I didn't know, right? And you made that analogy about dental hygiene, right? And physical hygiene, right? You exercise, you floss your teeth, you brush your teeth twice a day. But you know what's fascinating me? 5 years ago, you and I spoke about it and how important this is. Up
Hmm.
until now, I haven't heard anyone else talk about mental hygiene.
Hmm.
And why don't we talk about mental hygiene as much as we talk about physical hygiene?
I mean, that's a good question. I mean, I can't have I don't have a good answer for that one. I'm, trying to crack that code. We've been trying to promote it in our own way with the resources I have. The Royal Ottawa uh, has been, for the most part, a big supporter of mental hygiene. And I mean, I think we've probably reached out through the mental hygiene challenge that we would run every year. I don't know, 10,000 or so people. We tried to reach out to the Governor General. We tried a few attempts, but I think everything in its due time. I think maybe it's coming out in the conversation in different ways. Maybe people aren't calling mental hygiene. I don't think it matters what the term we use. I think mental hygiene is a good term, though. I do think it's intuitive to most people. It's a good tool for communication. So we'll see. I mean, this is kind of my life's work is the kind of promoting and encouraging this kind of stuff, and these things take time. Like just to go back to the dental analogy, like um, it took like literally 100 years for civilization to clue in that dental hygiene was important to to avoid
I really hope
serious.
this time it will take less.
Yeah, me too. Me too.
And I think it's when we talk about physical disorder like teeth, right? Like caries,
Hmm.
um, cavities. It's
Hmm.
just so obvious. Or when you have a client, when you have a patient with pneumonia, you can listen to their lungs and you can say, "Oh, I think you have pneumonia. Let me send you for an X-ray. Let me give you antibiotic, steroids." Right? Like the solution
Yeah,
is like
right there.
you can't go wrong, right? I mean, you're gonna try one antibiotic, it doesn't work. You're gonna go to a stronger one, right? Just to get enough coverage. But with mental hygiene, I think because it goes back to mental wellness
Hmm.
and mental illness, you cannot just obviously see it, right? So it
Hmm.
doesn't get as much exposure.
Yeah, it definitely is more subtle. I agree. It's not. Yeah, the subtlety of it. It's not like you said, like the pneumonia. It's like right there. You can hear it in your lungs. It's like the doctor can hear it. It's right there. It's just let's go. Let's kick this thing's ass and let's get it out of there. And whereas mental health is it's tricky because there's a huge interface with our mental health and our pride, our ego, our openness to change, or habitual thinking, to change your to be willing to engage in new habit formation. I mean, that's very hard. That's probably one of the hardest things to convey to people is to develop new habits. It's hard for myself to truly adopt and fully inhabit a new habit, like to fully live it. Something that I haven't done before that now I'm doing all the time. How many people do that? It's really hard. So it requires almost like a higher degree of self-reflection and transformation, and that's hard stuff. Like the convincing somebody to do that is tricky. I would say though that in my mental health practice that when I explain mental hygiene, like most people are like, oh yeah, like I never thought of it that way. That makes total sense to me. That it's not that you're going to change their world, but to give them a map, to give them a bit of a map of how to orient themselves in the right direction. I think that's more where, as a clinician and health promoter, like I want to give the right map, and what they do with it, it's not really up to me. But it's sort of like the World Health Organization, I've told you this before, but the World Health Organization and the CDC and Health Canada, they all agree. Like we should all aim for 150 minutes a week of physical activity. Like, you know, brisk walking, go for a swim, go for a bike ride, go for a hike, whatever, lift weights, whatever you want to do, as long as you do 150 minutes a week. So they create a framework. They gave everybody a map, a basic framework of what we should all try to aim for with physical health. And I think it's be good for us to start to think about it that way with our mental health. And I use the term mental hygiene, but if it ends up being a different term, as long as we're uh, you know collectively caring for our brains on a regular sort of day-to-day basis, I think we'll be all right as a species.
Thank you so much, Guillaume. It was a very interesting conversation. And I think some of the topics we touched upon today, we will come back to it again and we will talk more about philosophy and ancestors and how it all ties into our wellness.
Oh, thank you so much, Ibrahim. I had a great time. I really appreciate you inviting me to the podcast, and very much had a great time. Thank you so much.
Thank you, Guillaume. And